Hi, and thanks for joining us today for Words Matter. Are you like me and looking for a way to make a positive difference, especially during this pandemic when everything is so negative? One thing we can all do to improve the lives of long-term care is change the culture of institutionalized terms in the long-term care industry. Won't you join me in a word revolution? Let's start with this. The nursing home or assisted living home is the home for those who live there. Words such as wing, unit, feeder, wanderer, patient, lobby, and nurse's station do not evoke memories of a home. Unfortunately, much of the language spoken in long-term care homes is institutional and undignified. When it is said that a person is admitted or placed, it sounds like that person is powerless or even worse, being punished. Terms like bib, diaper, and daycare remind us of babies and children. Elders living in long-term care homes are a far cry from infants. They know diapers are for babies. Elders are human beings that deserve respect. Respect that using the proper language conveys. With that being said, there needs to be a change in the culture of language in long-term care. Recently, while in a home, I witnessed a caregiver push Mrs. Smith into the room to join a meeting, announcing, "I have another one for you," as if Mrs. Smith was joining us as an object, something to be moved from one location to another. With culture change, the caregiver should have announced, "Mrs. Smith would like to join you," or better yet, just let Mrs. Smith speak for herself. Keep in mind, language can be very powerful, negatively or positively. So instead of saying dietary services, how about dining services? Bib is a napkin, a cloth, or apron. Eat is dine. Who wouldn't much rather dine than eat? Feeder, a person needing help with dining. So instead of calling a person a feeder, which is very negative, just say that person needs assistance with dining. Here we go with diaper. How about underwear or brief? That's really what they are. Admitted or placed, moved in, discharged, moved out. Wing or unit. How about household, neighborhood, street, avenue? I have some homes that have named their hallways as street names. Nurse's station, a work area or a desk may be a better term. A lobby or common area. How about living room, parlor, or den? I don't tell my husband I'm going to the lobby when I'm really going to the living room. A shower room term is very cold and uninviting. So how about spa? Frontline floor staff? How about direct caregivers or even just caregivers? A resident is non-compliant. How about that person is exerting choice? So that would be what I would be doing. They may call me non-compliant when all I'm doing is exerting the choice to put salt on my food. How about instead of behavior problem or has behaviors, which makes the elder sound like a troublemaker, how about the resident is distressed or needs support or is having difficulty communicating? For facility or building, home or community would be a better term. And resident, how about neighbor? When hearing that you can't help but feel those living in there are part of a community and not just being housed there. And I have a home in my area that actually calls the people who live there neighbors. By using dignified language, one creates an atmosphere of respect. Challenge yourself, your loved ones, friends, neighbors, and staff, caregivers, to adopt a new language, a language that should no longer be a foreign language. Next time someone says to you or your loved one, "Here's your bib," kindly reply, "Thank you for the napkin." Words matter. You'll be changing one word, one attitude, one life at a time. For more information on long-term care topics, go to our website at voicesinc.info. Until next time, join us in upholding the dignity and quality of life of those neighbors living in long-term care neighborhoods.